big show today on this day before the 4th of July holiday. We've had dogs and Aikido, and now we're talking about a woman's health. If you are a woman watching today, your risk of getting breast cancer is increasing in spite of the avalanche of information about causes and cures. Now, why such a focus on the vulnerability of a woman's chest? Why would a noted cancer researcher compile his studies into a new book like this one? It's called Breast Health, all about prevention, diagnosis, and specific guidelines for diet and lifestyle that promote healthy breasts. We're going to get some answers now from our next guest from the Simone Protective Cancer Center down in Princeton, New Jersey, Dr. Charles Simone. Welcome, Dr. Simone. Great to have you back. I found the title so intriguing because I know this is always your area of study is cancer research in particular, but you talk about the whole area.
Well, what we need to do is really focus on how to keep breasts healthy. You know, we focus too often on a diseased breast. What can we do to keep them healthy? We know that 80% of all women have lumpy, bumpy breasts that hurt at times of menses. We know that 60% of all men after the age of 40 have enlarged breasts that are also painful.
40% of men?
60% of men over age 40.
Over age 40.
And usually the left breast in men is larger than the other. But there are lots of things that can be done in the benign group of people, the women and the men, who can become more healthy again. We outline supplements to take, healthy lifestyles to follow, etc.
Before, hopefully, disease does not happen.
Exactly.
We're trying to prevent that. Yeah. You know, I wonder, too, why so much focus on the incidence of breast cancer when there are other female cancers that are more virulent? I'm thinking ovarian, for example, has a worse death rate, I think, right? And lung cancer is the #1 cancer killer, is it not?
Yes.
Am I right on that?
Yes, that's
so
right.
Breast cancer is second, and certainly not to minimize its importance, but why do you focus?
It has always been more glamorous. More money has been spent on breast disease, breast cancer, much more lobbyists involved in breast diseases than ovarian. The number of ovarian cases is far less than the number of breast cancer cases, about 186,000 new breast cancer cases a year. So it's mainly a numbers issue and the glamour of the issue of lobbyists.
And also that, as you said, there are things we can do in terms of prevention and making our breasts healthier.
Absolutely.
So that's what we're talking about here in this book in particular. Now, the odds of developing breast cancer, why so high?
1 in 8. In 1974, it was 1 in 17, and over the years, it's gotten larger and larger and larger, worse and worse.
And do we know? What do you attribute it to?
Yeah, we know most of our problems are attributed to risk factors. Nutrition is the #1 risk factor for causing breast cancer, not genetics. Genetics plays a role, but in about 5% of all women. 5% of all women have a gene linked to breast cancer. 95% of the women have other issues that cause breast cancer.
So the breast cancer gene is real?
It is real.
It definitely is, yes.
And it causes cancer in about 5% of the women.
5%. So one of the things we're going to be talking about in the next few minutes, we're going to take a short break. We're going to get very specific about these nutritional alternatives that we have that we can start incorporating early on. If we have daughters, we should start teaching them and incorporating these into our lifestyles, into our diet. This is Dr. Charles Simone. We're looking for your phone calls, 1-800-988-TALK. If you have problematic breasts and you want to make them healthy, stay with us.